Hey guys, so I know it's been forever since I made a YouTube video updating you guys. I'm sorry, I don't know. I just haven't. Adrian moved in with me, it's been kind of hectic, so I just haven't really had the time to, sit down and make a YouTube video. So I'm gonna do that right now. It's gonna be short, though, because I have a shit ton of stuff to do. So I'm 2.5 months post-op, my chest is looking really good, the infection's totally gone. Yeah, so that's still a thing. That's going pretty well. You guys can see it in my next video. I don't want to take my shirt off right now because it's cold as shit. So yeah, my next video will probably be in the beginning of January, so my, 3 months post-op. As for other things, I've been off of testosterone for over a month now, and it's really starting to get to me. I keep getting my period. It's really not good. So yeah, that happened. I talked to my endocrinologist, and she's switching me to Lupron, which is the injectable form of an estrogen blocker. It works a lot faster. It's one shot every 3 months. It's really good. It'll stop my periods immediately, which is really nice since Arimidex isn't doing jack shit. Yeah, so that's something that's gonna happen. The Lupron people did call me, though, because you have to fill out, a ton of paperwork. And so they called me to, give me this, interview, tell me, what the medication does, all these different things. And so they went over it with me. They couldn't tell me if my insurance is going to cover it or not, because there's, an issue with my insurance right now, which is why I had to, pay for my tea, which I can't inject until next week, because I want to stay on my schedule. But yeah, it's $53 later. But anyway, these Lupron people called me, and they were talking to me, and I went over the rest of my medications with them, and everything was fine. And then I asked to speak to a pharmacist to go over the medications that I'm on and whether or not there are any drug interactions with them, because some of the new meds I'm on are, new, and they can interact with, weird shit. I know estrogen interacts with things, so I know that testosterone has them, too. So I just, wanted to make sure. And so I went over them, and I listed all the medication I'm on, and they were like, well, there's no noted, interactions or side effects here, but because of the medications that you're on, I have to tell you, seizures are very likely with Lupron, and so are extreme mood shifts. And I'm just sitting here, bitch, what? Bitch, what? Where? When? Why? Who is she? I'm gonna straight up have a fucking seizure one of these days. No, I'm dead. I'm really serious, because I'm on so many different medications that are oh, we can cause seizures. And one of them is an anticonvulsant, so it's supposed to prevent seizures. But if you don't have them already, which I don't, they can cause them. And because of my weird, deja vu seizure thing, I'm, at a more likelihood of having, a different kind of seizure. And I've been having those, little weird, can't control my, limb things. I don't know if that's a type of seizure. I don't know what the fuck is happening with me. I see my psychiatrist this week, though, so I'm going to talk about that with him, because that's his area that he needs to fucking fix. And I have to tell him that I'm starting Lupron, so he knows. So yeah, that's a thing. And the mood shift thing, my bipolar ass I just cannot. Can't do it. So we'll see. But also, if I get my period again, I'm going to actually harm myself. Which I told my doctor. I was listen, Mary, we gotta talk. And so I talked to her and told her that. And she was I see it. She said that I was being very patient and that she's surprised I haven't done anything so far. Which I don't know, I kind of appreciate, because I do feel like I've been incredibly patient with my body and with the whole transitioning process. I really have been, but I'm so fucking over it, and I really can't get my period again. I cannot do it. But I think it's gonna happen at least once more before I start Lupron, which is gonna really suck. But yeah, so that's the thing. I'm gonna talk to all these doctors and just check everything over. I'm hopefully starting Lupron in 2 weeks. Yeah. So I probably won't make another YouTube video until the start of the new year, because it's the 17th now, and nothing is gonna happen in between then. So yeah, see you guys at my 3-month post-op video. Have a nice holiday.